People are eating more and more fatty food and more calorie consumption, non-veg, and almost if you see any family, they are ordering Swiggy left and right every day. See, in olden days, people used to eat non-veg only once in a while. And then not only that, more fatty, more bakery items, and more sugary containing beverages. All this will contribute to. That is the reason more vehicle population, sedentary life, sedentary life, sedentary at the same time more consumption of the diet, and at the same time increasing. And moreover, people are not undergoing regular checkup. Like they are not checking the blood pressure and diabetes and cholesterol level. Cholesterol levels sometimes even WhatsApp also false messages are there. Then cholesterol not important, but it's worldwide very well proven that if you cholesterol there is it. If you are reducing 20 milligram per deciliter, then 10% reduction. HDL if you increase 1 milligram, 2% risk reduction. That's the reason always maintain the figure like a blood sugar periodically. Check is it fasting blood sugar normal, postural normal, HbA1c 6.5 below. Blood pressure is it the I will one of my patient I did the plasty about 20 years back, acute angioplasty. She's but her son, he had a hypertension, but he neglected. He was telling that I'm only 35, I should take medicines, I don't have any symptom. Believe me, he was admitted in our hospital with massive cerebral bleed. He was bedridden. Craniotomy was done, and they did, and 1.5 month patient stayed. Now he's bedridden. So those things can be avoided. So blood pressure treatment is widely available. Even MBBS doctor also can treat. And periodical checkup. Is it many times what happens? They irregular treatment more harm. And the treatment when you take it adequately and control it. If you see the cardiovascular death, the first rank China, because their population is also more. Second rank India, even today. That's the reason because more number. We are genetically more prone for heart disease. There is a CADI study. In the CADI study, they have compared American, Japanese, Chinese, and Indians. So the Indians who migrated to US, there they conducted study. We are 7 times more prone compared to Japanese and Chinese because we are genetically more prone. God has given one gift, but we have to. Why He has given to lead a more disciplined life. Take a right diet, go for good exercise, and control the risk factors. Most of the time, don't indulge in smoking. If you are a smoker, stop smoking. At least you encourage others to stop smoking. Alcohol, don't indulge. See, these are all important. Don't gain weight. If you are gaining weight, shed the extra kilos. Definitely that pays. Maintain a good environment, sanitation. All these factors will play a big role. It improves the longevity at the same time. Sometimes, okay, once the disease develops, please don't ignore the symptoms because in few seconds patient can die. If it reaches the hospital late, if they are undergoing early treatment, the treatment cost is less. Suppose acute MI is there, massive attack. If it's reaching late, 1 day later, muscle is gone. That time we have to put ECMO, we have to put some IABP support. Cost may go to 25-30 lakhs. If the same patient if comes within 6 hours, it may be finished in 2.5-3 lakhs. Because by that time, the cardiogenic shock took place, a multi-organ dysfunction takes place, we have to give a ventilator support. Seeking early advice. That is very important. Nowadays, WhatsApp is available. You take ECG anywhere and send it. We are ready to give free advice. Every doctor, but no matter what, every doctor advises free of cost because it helps others. So acute MMS. So that is the reason now the advantage of the cell phone is very. Go to the nearest center, take TRAPI, take ECG, immediately send. Okay, really risk group, hypertension, blood pressure is there. Our age group is there. In such cases, first ECG in heart attack, only in 60% of the patients, first ECG will be abnormal. 40% ECG will not show. That's the reason repeat ECG we say. If the heaviness symptoms are classical, immediately 1 hour later, 2 hours later, repeat the ECG. That time it can detect. Serial ECG we say. But symptoms are there. Most of the time, cardiologists will say symptoms are classical, ECG normal, echo normal, stay in the hospital. That's the reason always take the specialist opinion.
Last question, sir. So normally doctors says that don't take medical checkups or diagnose blood tests from a small place or who comes to your doorstep. Take it from a very recognized, like say, something like okay, your hospital or SDRC. So is that true that the people who comes to door visit and take it, is that accurate or not?
Yeah, that is important. What happens, what kind of equipment, it's my personal experience. We opened
Even
one,
I had
I will
experience.
tell you why we opened one diagnosis. I told all my associates also. We opened one diagnosis center in the periphery to one of my assistant without taking blood sample gave a blood report. And then because the mindset of the money corrupts. If you keep a lab technician, that person, if no monitoring is there, what happens that time? He may indulge in see, we are all humans. We are prone for so many temptations. Like a good quality, if you know that person reliable, quality of the track record is good, go there and take the report. Like corporate setup, big setup, they be very high end equipment. Many people will be monitoring, pathologists will be there, microbiologists. If a doubt is there, they take second opinion. So that's the reason the quality is assured.